Hello YouTubers, and welcome to my channel, Lady Nephrology, where we talk all things nephrology. My name is Kendra Morris. I am a board certified family nurse practitioner, and I have more than 20 years of nursing experience, and most of my experience has been with nephrology patients. I've taken care of chronic kidney disease patients, patients on dialysis, and also kidney transplant patients. And I just really have a passion, and I love working with dialysis patients, kidney transplant patients. And this channel is really more focused toward women living with chronic kidney disease, because throughout many years I have really dealt with a lot of different women on dialysis, received transplant, and it really has a near and dear place in my heart. So today's topic that we're going to be talking about is we're going to continue discussing chronic kidney disease. Chronic kidney disease, also known, abbreviated as CKD, is a condition that is characterized by gradual loss of kidney function over time. So usually it's more of a slow process. And what your kidneys do and responsible for, they're responsible for filtering out waste and excess fluids from your body, and then which then is excreted into your urine. So when CKD reaches an advanced stage, there's dangerous levels of fluid, electrolytes, and waste product that builds up in your blood and in your body. And so early stages of CKD, a lot of people do not experience any signs or symptoms. A lot of times the signs and symptoms become more apparent once the kidney function is significantly impaired. So usually not until you reach CKD stage 4 or 5, which is GFR, which is a glomerular filtration rate of less than 30 mils per minute, that the disturbances in the water and electrolyte balances become really clinically manifest, and patients really start to develop those symptoms. So treatment for chronic kidney disease, it really focuses on slowing down the progression of kidney damage, usually by controlling the underlying cause. And like I discussed last time, the main two causes of chronic kidney disease is diabetes and high blood pressure. So chronic kidney disease, it can lead to ESRD, which is end-stage renal disease, which is fatal without dialysis or without a kidney transplant. So a lot of patients, once they reach that level to end-stage renal disease, they basically either have to be on dialysis or a kidney transplant to survive. And if they choose not to do either one, a lot of those patients do pass away. So this is really important and serious condition, okay? So some of the signs and symptoms of kidney disease include, and especially, like I said, most of the signs are more apparent once the kidney disease is impaired. So some of them include nausea, vomiting, loss of appetite, fatigue, weakness, decreased mental sharpness, shortness of breath, itching, and high blood pressure that is uncontrolled. And risk factors for chronic kidney disease: diabetes, high blood pressure, cardiovascular disease, smoking, obesity. Also more prevalent in African Americans, Native Americans, and Asian American populations. And also having a family history of kidney disease puts you at increased risk, along with older age, because as you age, your kidney function does start to slowly decline. And diagnosis, how we diagnose. Usually we don't screen for kidney disease in asymptomatic adults that do not have a risk factor of kidney disease. So most adults that don't have any risk factor or any symptoms, we usually don't screen. But some of the tests that we do to screen for kidney disease, we do a lot of lab work, a lot of blood work, which we do a CBC, which is a complete blood count. We do a BMP, which is a basic metabolic panel, urinalysis. We check serum albumin levels. We check the lipid profile to check for cholesterol levels. We check a serum calcium and phosphate levels. Also check 25 hydroxide vitamin D levels. And also another blood test that we check is the intact parathyroid hormone, which is the PTH levels. So we do tests with checking a lot of blood work. And we do also do some imaging that we do, which is a renal ultrasound, which looks at your kidneys. And sometimes another imaging that we can do is either a CT scan or MRI of the abdomen and pelvis area to look at your kidneys to see what's going on that way. And usually once the last resort or the most invasive to check for kidney disease is to just do a kidney biopsy. And that's usually reserved for some severe symptoms. You have a lot of proteinuria or things going on, a lot of symptoms, and that's kind of reserved for last because that's more invasive. So, we kind of discussed some of the signs and symptoms of kidney disease, some risk factors, and also different ways to diagnose chronic kidney disease. So I like to keep these very short and to the point. And so the next week's topic we will be talking about is anemia in chronic kidney disease. So we'll be discussing that next week. So every week we'll just have a different topic dealing with nephrology and kidney disease. So if you know any ladies out there who are suffering from chronic kidney disease or end-stage renal disease on dialysis, any ladies who are have a kidney transplant, please refer them to this channel. This is Lady Nephrology, where we talk all things nephrology. Okay, you guys have a great day and a great week, and I'll see you next week. Bye-bye.